Hey, Senator Bill Cassidy here, but I'm coming to you not as a senator, but as a doctor. A doctor who treated patients in the Louisiana's public hospital system for 25 years, taught medical students and residents, and did public health programs immunizing students, children against hepatitis B, a form of a virus. Well, now coronavirus is here. And I went to a reception and I was speaking to someone, and he told me, you know, Bill, no one knows anything about the coronavirus. A coronavirus is a virus which is spread similar to the flu. After you're infected, if you have symptoms, it can take 2 days, 14 days, maybe as long as 4 weeks for symptoms to begin. Symptoms? They can start off with just a fever or a cough, and if you have a severe case, it infects your lungs. The coronavirus is a germ. And it's a germ in this case that we get from breathing it in. And we give it to others if someone is infected by breathing out. So if you have a family member who's infected, quite likely you might be infected. You just don't have the symptom. There's a difference between being infected and having symptoms. If you have symptoms, think of a dry cough. If it worsens, then you begin to have a hard time breathing. If I am infected, what happens? First, if someone is exposed, it's typically, so we've seen so far, 2 days to 14 days to get symptoms if you're going to have symptoms. In some people, it can be longer. And we've talked about the typical flu symptoms that can occur, but it can also progress to pneumonia. Now, my friend at the reception said, what is pneumonia? Well, here you see a bunch of viruses looking just like spiked balls coming into the lungs. And as you see it going into the lungs, it spreads out. Now, we just show you 20 or 30. In real life, it would be millions of these viruses that are coming into your lungs. If somebody has a problem, then the virus is attacking the lung tissue. It just sits there and chews it up. As that happens, you begin to get scar tissue. So you see all those white lines, you get inflammation, you get fluid buildup, and then you get scarring where that occurs. But the more scar tissue you get, the more inflammation and fluid, the lungs don't work as well. And so it just kind of pulls that lung down. And instead of taking a breath and oxygen moving into your bloodstream and bringing carbon dioxide back, now the lungs don't move as well. And it's so filled with fluid and scar tissue and inflammation, the oxygen does not move into the blood. As that happens, you have less oxygen in your bloodstream, you have more carbon dioxide building up, and that's when people go into respiratory failure. That would be a severe case of pneumonia. Everything I've been talking about is pneumonia. How do you protect yourself? Well, get your flu shot. More people are still going to die from flu this year, so it's projected, than will die from coronavirus. Secondly, be conscious about washing your hands. I take a little bit of hand sanitizer with me, and I just every now and then pull it out and just kind of do this. Again, sneeze into your sleeve, not out into the atmosphere. Now, you may even want, and if you're handshaking, if you meet somebody who clearly has the flu, you may not want a handshake. You may want to bump fist, or I like the crawfish boil handshake. I'm going to have my assistant help me demonstrate. Boom! You know, you got a crawfish boil and your hands are all messy and they got their hands. You don't want to shake hands. You just bump those elbows. People ask about wearing masks. Not recommended yet. Not necessary. There's not enough of coronavirus in our society. Then just take care of yourself. Drink water, gets plenty of rest. Let me speak briefly about the administration's response. I think the president's done the right thing. Don't panic. In the meantime, let's use our past experience with infections like Zika or Ebola, in which through the George W. Bush administration, President Obama's administration, and President Trump, we've put in mechanisms that our society can respond to infectious disease. This includes the Center for Disease Control, the Food and Drug Administration, the NIH, Health and Human Services, all have plans in place to both monitor and track the disease, to find a cure, to get the drugs out there as quickly as possible, and to make medical care available to those who might have needs. I'm working personally on several things. A public health expansion bill, trying to expand telehealth, so if a senior citizen wishes to stay at home and communicate with her doctor, she could do it through her iPad. trying to cap the cost of prescription drugs so that if a drug does come out and it's very expensive, the senior citizen can afford it. And lastly, working with state health officials and with the governor's task force. If they need me, I'm there for them, and I'm sure that they know that if I need a help, that they'll give me a hand. We're going to work hand in glove to protect the people of Louisiana and the people of our country.